In the months since Trump was elected, much has changed for American healthcare workers.
So taking Tylenol is not good. All right, I'll say it. It's not good.
We are the sickest country in the world.
Job cuts, changes in vaccine policy, and fear for many of delivering care in the face of immigration raids.
The story breaking out of Washington this week left both the political world and the medical community reeling. Reports are pouring in that thousands of U.S. doctors, specialists, family physicians, even ER staff, are leaving the country and heading north to Canada. They're not moving for money, luxury, or fame. They're escaping chaos. And tonight, the person most stunned by this mass exodus is Donald Trump himself. The Trump administration, which once promised to make American healthcare the best in the world, now faces what many insiders are calling a full-scale implosion. Hospitals in several states are short-staffed. Clinics are closing early. Wait times for surgeries have doubled in places like Texas, Florida, and Pennsylvania. Meanwhile, Canada, calm, organized, and welcoming, is quietly recruiting American doctors who are desperate for stability and sanity. The images flooding social media tell the story better than any press release. A line of cars at the Manitoba border. A physician holding a U.S. medical degree in one hand and a Canadian job offer in the other. A photo of an empty doctor's office in Chicago with a handwritten note taped to the door. "I can't do this anymore." Trump's advisors reportedly warned him weeks ago that a wave of medical resignations was coming, but few believed it would reach this level. NPR reports that American doctors are leaving not just because of pay, but because of politics. They're tired of being told how to practice medicine by bureaucrats. They're tired of budget freezes, legal uncertainty, and what one doctor called a complete loss of moral direction in the U.S. healthcare system. In a press conference, Trump appeared visibly frustrated when asked about the trend. "We've got the best doctors in the world," he said, "and they're not going anywhere." Believe me. But just hours later, Canada's health authorities confirmed hundreds of new applications from U.S. medical professionals. The CBC reported that Manitoba, Alberta, and British Columbia are all fast-tracking U.S. doctors under emergency credentialing programs, the same ones once reserved for wartime shortages. Behind the headlines, this is a story about broken promises and human exhaustion. Many doctors say they're done fighting an uphill battle against what they describe as an unstable system. A family physician from Ohio told NPR, "It's not about Trump personally. It's about the direction everything's going. We're spending more time dealing with politics than patients. Yet Trump's influence looms large. His administration's decision to restructure Medicare reimbursement models and privatize certain hospital contracts sparked waves of uncertainty across the medical industry. By mid-2025, several state hospitals had seen budget cuts of up to 30%. Teaching hospitals reported unprecedented burnout rates. And as the White House focused on tax reforms and election rallies, Canada quietly positioned itself as the safe alternative, a country where healthcare workers could breathe again. For Canadian recruiters, the timing couldn't have been more perfect. Manitoba's health minister proudly announced a new program offering relocation bonuses, housing support, and permanent residency to qualified U.S. doctors. "We're not stealing talent," she said. "We're providing a home for those who've lost faith in their system." That single line sent shockwaves through Washington. American policymakers, already grappling with hospital shortages, realized what was happening. Canada wasn't just recruiting talent. It was symbolically winning a war America didn't know it was fighting. The war for stability. Across rural America, the crisis is turning personal. In Nebraska, a single physician now covers 3 counties. In parts of Georgia, emergency patients are being airlifted hundreds of miles because local ERS can't stay staffed. The headlines scream collapse, but the reality feels more like abandonment. The people who kept the system alive through the pandemic, nurses, surgeons, and family doctors, are walking away one by one. Trump's allies on Fox Business tried to downplay the exodus. "It's just a handful of liberal doctors looking for free healthcare," one commentator joked. But the numbers tell another story. According to data reviewed by CBC and Campus Safety magazine, over 8,000 American physicians have applied for Canadian certification since mid-2024, a figure that experts call unprecedented in modern history. When pressed again on the issue, Trump shot back, "If doctors want to leave, that's their choice. But the smart ones are staying here. We're cutting costs. We're making healthcare great again. And Canada can't compete with that." The statement quickly went viral, not for confidence but for irony. Within hours, #DoctorsForCanada was trending across social media platforms, with hundreds of American healthcare professionals sharing their relocation stories. One of them, Dr. Emily Rosen from Michigan, wrote, "I spent 12 years training to serve my community. I loved my patients. But after 2024, I felt like I was working for a political machine, not a medical system. In Canada, I can focus on healing again." Her post gathered over 2 million views in 24 hours. Mark Carney, Canada's finance minister and former Bank of England governor, added fuel to the debate when he commented publicly that Canada's healthcare system thrives when professionals feel respected and secure. His calm, statesman-like tone contrasted sharply with Trump's defensiveness. The difference in messaging and in leadership couldn't be clearer. By early October 2025, U.S. hospital networks were reportedly holding emergency meetings to discuss recruitment shortfalls. The American Medical Association issued a rare statement urging the federal government to address systemic instability before more doctors leave. Privately, even Republican governors began urging the White House to act before winter, warning of catastrophic staffing shortages in rural hospitals. Yet Trump's strategy seems focused on optics, not reform. He announced a new patriotic healthcare initiative worth $50 billion, a mix of bonuses, tax incentives, and deregulation. But analysts say the plan came too late. "Money can't buy trust," said one healthcare economist, and that's exactly what's been lost. Meanwhile, in cities like Winnipeg and Toronto, American doctors are settling in. They speak about culture shock, not because of the cold, but because of how different the system feels. Appointments run on time. Administrative staff smile. Patients thank them without suspicion. As one newly arrived physician said on CBC, "It's surreal. I'm doing the same job, but it feels like I'm in a different world." For Canada, this migration is both a win and a warning. While it boosts its healthcare workforce, it also highlights how fragile the U.S. system has become. Canada's national papers describe it as a reversal of history, a time when the richest nation on earth is losing its best minds to the one next door. But the shockwave isn't just political, it's emotional. For millions of Americans, this is personal. When your family doctor leaves, it's not just a staffing issue, it's a symbol that something deeper is broken. Families are asking, if the people who heal us are fleeing, what does that say about the health of the country itself? Trump, ever the showman, has doubled down on his message. In a fiery speech at a rally in Des Moines, he told supporters, "We're going to fix it. Big league. These doctors will come back. They always do." The crowd cheered, but behind the slogans, many wonder whether those words ring hollow. Because as of now, few seem to be returning. Economists point out that the brain drain could cost the U.S. healthcare system billions. Each trained physician represents an investment of roughly $1 million in education and residency. Losing thousands means losing generations of experience. And that's not easily replaced. In Washington, the mood is shifting from disbelief to quiet panic. Internal memos from health agencies reportedly warn of potential national emergency declarations if staffing levels fall further this winter. The White House insists that everything is under control, but insiders describe an administration in damage control mode, scrambling to spin a story that's already out of its hands. Across the border, Canadian leaders remain diplomatic, but confident. Prime Minister Justin Trudeau, in a press briefing, said simply, "Canada will always welcome those who seek stability, compassion, and respect." His statement drew applause and a subtle sting. It wasn't just about healthcare. It was about values, and that's the part that seems to hurt Trump the most. Because while he measures success in dollars and headlines, This moment is about something deeper: the loss of faith. America's doctors are sending a message louder than any protest. They're voting with their feet. In the heartland, patients wait longer. Hospitals run thinner. And the president, once certain of his grip on America's destiny, now faces a crisis even he can't brand away. The collapse didn't come overnight, but the realization did. One day, America woke up and realized that the people who were supposed to heal its wounds had left. Not because they didn't care, but because they couldn't stay. And as the border lights flicker between North Dakota and Manitoba, as the stethoscopes change hands, one truth becomes impossible to ignore. The American healthcare system isn't just sick, it's losing its doctors. And for Trump, the man who built his legacy on being unbeatable, this might be the one thing he truly couldn't control.